Welcome to Beauty and the Brain with your hosts, Dr. Chris Croley and nurse practitioner Jerry Drinkard. Get ready to dive into the latest in revolutionary treatments, cutting-edge devices, and wellness secrets. Whether you're a consumer or provider, we're here to empower you at the forefront of beauty and aesthetics.
Hi, everyone, and welcome to another episode of Beauty and the Brain, the podcast where we discuss all things aesthetics. I'm your co-host, Dr. Chris Croley.
And I'm Jerry Drinkard, family nurse practitioner, and together, Chris and I own Skin and Tonic, a med spa located in Pace, Florida. We're very excited today to have Dr. Kimberly from Golden Rose MedSpa in Orlando, Florida, to join us. The name of your spa makes me want to come and visit.
Thank you, first of all, just for taking time. I know you're super busy, so we really appreciate you joining us. I've known you for a while now. We first met through Empire Medical Training, and you were taking some classes, and then I've seen you over the years. I just recently saw you in Miami at AMWC. We had a great time at that conference.
That was an amazing conference, and I cannot wait for next year, honestly. I'm so excited already.
And you're kind of, like many of us in aesthetics, your patient should feel in great hands, because I know from everywhere I see you and knowing you over the years, you're always pursuing education. You're always trying to learn everything you can to equip yourself to take the best care of your patients in the aesthetic and medical realm. And today we're appreciative that you took time to be on here, but we're going to be talking a little bit about some bioidentical hormone replacement therapies and hormone optimization. It's a controversial topic in a lot of different circles. A lot of patients have no idea where to go and find this kind of treatment. Thank you for offering it, and thank you for taking time to share with us some of your expertise on this area.
Yeah, we're in 2024 already. I think it's time for people to be educated. It's no longer 2002 with this big, women's health initiative. Research came around and basically all women needed to be off birth control, hormones at that time. And everything has changed ever since. And I think it's time for us to educate our clients and our patients that, hormones are not your enemy. They're actually your friend. And there's still this taboo that I still see every single day with my patients when they come for consultations. And I have to go back into the science and print peer-to-peer research and show them, the problem is synthetic hormone.
What does it mean when people say bioidentical hormones? What is the difference in that and what you say is the problematic synthetic hormones?
So I think, we're humans. That's the first thing that we need to understand. And synthetic hormones are derived from the urine of mares, and we are not mares, we're not horses. And, traditional birth control is synthetic. So it comes from the urines of mares. That's why some people just don't really respond to hormonal birth control, and they have all the side effects and so forth. When we talk about bioidentical, what it really means is that we're kind of recreating your natural hormone and giving it back to you. For the most part, this is being done at compounding pharmacies, although there are some commercial pharmacies now providing bioidentical hormone replacement, but insurance are not wanting to cover that. So we still go back to the compounding route, and they just basically compound the bioidentical hormone, and we return it back to you.
Bioidentical means that we are replacing your own, and they're not getting this from the pregnant mare urine. So where do bioidentical hormones, where do they come from?
So when they were doing research trying to find out bioidentical, and this goes back to the Egyptian times, basically they were looking at what can they use to replace human hormone that is structurally the same as the human hormones. And they found that yams had the same structure as a human being, and that's where they get the hormones from.
And so this is for specifically for estrogen, for progesterone?
Well, estrogen, estradiol, estrogen, progesterone, testosterone as well.
So all of them can come from yams?
All of them can come from yams, yes.
Very interesting.
Tell us a little about your background and your history and how you got into the hormone replacement.
I can be here until tomorrow talking about that. So I did primary care since 2016. And, I realized that that's not where my heart is, because my patient is not a number for me. And I was always running behind when I was seeing patients because I wanted to get to know you and ask you all the questions. And even though you're coming for your 3 months follow-up, I still want to know what's going on. And 15 minutes is not enough. By the time you get your vitals done and everything, and I walk in, it's been already 10 minutes. And we have 5 minutes left for your visit before I have to go to my next patient. So I realized that's not for me. I can't deal with the traditional medicine model. And I just wanted to kind of see what else can I do that gives me pleasure. And then I can see my patients and talk to them. Like right now, when someone's new to my practice, I give them a whole hour out of my time. And we'll get to know each other. We just, talk about your family, everything, because you're not, in my opinion, you're not overweight or obese because you're just eating too much McDonald's, right? Like there's always something happening down deep that we need to kind of find out. Because if we don't get to the root of the problem, we're just going to be in the circle over and over. So I decided that primary care was enough. I don't want to do that anymore. And I decided to, invest in education, go back and learn a little bit more about functional medicine and learn about aesthetics.
Excellent. And so now what part of your practice now is comprised of aesthetics and what part functional medicine?
I would say about 75% of my practice is functional medicine.
Wow. I think Jerry and I well know what that is, but I really want to educate some of the listeners out there that may never have heard this term or even understand about this specialty, because it's not, the practice has been around for a very long time, but the terminology has not been used. And so I find that a lot of my patients now, if I mention that term, some of them are like, what is a functional medicine doctor? Can you tell us a little bit about what you do as a functional medicine physician?
And this is how I explain this into my patients, is we're going to get to the root of the problem. Like what's actually going on in your body that is making you have A, Y, and C symptoms. Like we do not just regular, serum blood work. We do saliva testing. We might do urine testing because I believe in the saliva and the urine, you get better results of how accurate your hormones are in your body. Some, can go that route. So we go the traditional serum blood work. But I think, honestly, we just look at the whole person. And I look at everything that's going on, from diet to exercise to supplements to your medical history and surgical history, of course. But I just see you as a whole, not just asymptomatic patient.
Do you still use traditional medications in a functional medicine practice?
I still do. Yes, absolutely. I think there's a fine line, between traditional medicine and functional medicine. And I think when you combine them together, your patients get better results.
Yeah, I mean, I personally actually agree with that. I think, again, I want people to understand that just because you go to functional medicine, it's not all vitamins and herbs and eat a healthy diet and all your problems are fixed. That sometimes there are medical problems that still need to be addressed. And you are a, trained physician, primary care physician, and could have very well went the traditional path. And you went and did extra additional training to learn how to incorporate more natural alternatives, how to optimize the functioning of our body, which is where this really functional medicine term comes from. So you're optimizing the way our body functions. And then you're incorporating what is dear to our hearts, aesthetics, into that. So you're making them look good while you're making them feel good.
I think functional medicine, when you say that, I think it's the assumption by a lot of people that it is a non-traditional type of medicine and that there may be a less education rather than more education there, because you have such a combination of your traditional, management of disease processes, and now you go this extra mile to manage them in a natural way. And so I think it's real interesting for people to know that there's something out there other than just traditional medicine.
And I think because of social media, people are being smarter. And back in the day, my parents, when they would go to their medical provider, they would just say, okay, this is your medication. I'll see you in 3 months. And you're like, okay, that's fine. Like you were not asked questions.
Well, one of the things that you mentioned and kind of giving us your background is that hormones tie into many aspects of our health. So it's not just our overall, the way that we feel, the way our body functions, but also in the way that we look. It impacts many things from our mood, our blood pressure, our sexual desires, all those things are impacted by hormones. So in your practice, do you do male and female, or do you specialize just in female?
We do male and females, and it's usually the female that comes first, and then they bring their partners. That's the reality.
Yeah.
But I love when I see couples that come to the practice and they just want to get better as a whole.
What would you say is like your most common complaint that gets people in initially for hormone replacement therapy?
Usually, it's I can lose the weight since I became menopausal.
Yeah.
But it's funny, I'm seeing more younger and younger females come into the office with symptoms that I used to see in my 50 years old. Now I'm getting 35, 36-year-old patients telling me they can't lose the weight, they're having anxiety, depression, insomnia, dry skin, low libido. And I'm like, what? You're so young. Like in my head, like, you're so young to be having this. But, as I keep getting educated and learning more about this field, did you know you can start having symptoms of perimenopause when you're 35 years old? I just learned that not so long ago.
I knew it was a variety of ages. I didn't realize it went all the way down to 35.
I just learned that not so long ago, and it kind of freaked me out a little bit.
Do you think this is something new? Do you think we're paying more attention to it? Or do you think this is a result of something going on in our culture and our society? Things such as hormonal influences from modified foods, from our diet, from a poor diet, highly processed foods. It's kind of pushing us into that andropause or menopause at earlier ages. What's your thoughts on that?
So I think it's an environmental factor, of course, with hormonal imbalance. If you go to other countries, I mean, I was in Japan not so long ago last year, and I spent there about 3 weeks, and I saw people, and they were, skinny, they look good, they don't look like they're aging at all. And I started talking to a couple of people because they were part of the cruise that we went, me and my husband, and they eat very healthy, very natural. They don't eat fast food. They don't drink sodas. They don't do too much alcohol. They really feed themselves from the air. So I do think there is an environmental component. I mean, the Western diet, everything is fast food, rice, bread, pasta, French fries. And you keep putting that into your system over and over for years and years. And of course, there's going to be something happening into your health. And I think that's why we're seeing younger people having this complaint that we used to see in a 50-year-old.
When we start talking about the hormone replacement therapy, and is it a lifestyle that they're going to have to adopt from here out? I know people have questions. A lot of people don't want medications that they have to take daily. What are their options as far as hormone replacement?
So the beauty of this is you don't have to do hormones if you don't really have to. There's a lot of supplements that we can use to help you with your symptoms. I'm a big fan of ashwagandha, and I think you spoke with Dr. Greenleaf, and she's also a big fan of ashwagandha. I am too. I love DHEA. I think it really helps you optimize your hormones to a certain point. Like there are some clients that they just don't want hormones. They want the supplements route. And for the most part, it's because I think they're afraid of what they heard throughout this year, that hormones are going to give you cancer. But that's not true. I mean, if you look back into the data, back into the research, bioidentical hormone replacement does not give you cancer. And that's something that I really want people to understand, because I don't think people should suffer, honestly. People should not suffer through menopause, perimenopause, and postmenopausal. And if I might, share a story, right now as we speak, my mom is in the hospital due to a complete rib fracture that she had from a fall that she had last week.
Sorry to hear about your mom.
I certainly hope everything turns out okay with her. We'll keep her in our prayers.
Thank you. She's postmenopausal. And of course, osteoporosis happened when you become postmenopausal. And the lack of estrogen is what's giving you brittle bones. And if she would have known better, maybe 10, 15 years ago, she might have been on estrogen, this might have been prevented. So it really hits me hard when I see people, females, suffering from fractures due to osteoporosis that could have been prevented. I think, the system should change. Medical school should change, nurse practitioner school should change. So we get more hours in how to actually treat the female once they become menopausal.
Yeah, that's interesting. I do think there's a lot of focus on the risk of hormone replacement, but I don't think there's a lot of focus on the risk of not optimizing hormones and the downstream effects of things like osteoporosis that could be possibly mitigated. I'll let Jerry tell this story. I don't know. Do you want to tell the story of one of your favorite patients from, we've been in practice for a long time now. We're old and we need all the hormones that we can get. So from any source, yams, horses, whatever, give it to us. But all jokes aside, we've been in practice for a while, and we had an office over across the line in Alabama 13 years ago, a long time ago. And one of Jerry's favorite patients, she had been resistant to the idea of hormone optimization for a long time. And we toyed with it bits here and there, but I have to give it to you. I really think to do hormone optimization and do it properly, it's not just looking at numbers. Like, a lot of us can just look at labs, look at numbers, and give a prescription for something. But I think to really do it justice, you've got to spend enough time to listen to your patients and listen to their symptoms, because not everybody is going to respond exactly the same, and not everybody's going to have their symptoms treated at a specific level. We have opted not to do it and partner with people who do a very good job at it and take the hour-long appointments that you just mentioned about to really get to know the patients and then make sure their follow-ups are addressing all those needs. But this patient at that time, I'll let you tell this story, Jerry, but you sent her out and...
Yeah, so I actually have a couple of stories about my sweet patient. She and her husband, they were probably mid-60s, I would say, and started kind of trying to spice things up. And so the husband got on testosterone therapy around the same time that she started. I'm assuming this is the same patient. If not, we have another story. And she said that she and her daughter, they were trying on swimsuits together and shopping, and so she's like, "Mom, your boobs look really good in this swimsuit. You should send a picture to Dad and just to spice things up." So she sent a picture of her boobs to her dad, or to her husband rather, in her swimsuit. Well, they didn't expect for Dad's testosterone to kick in and him to respond or reply with a photo of himself, but he didn't have on trunks when he sent it. And he sent it to the cloud, so everyone in the
family share plan.
Oh my God.
And so the hormone replacement therapy really got them fired up and ready to go. And she said that she knew for a fact she had to go back and get her levels checked because she was driving down the road, and she said she just felt a really strong urge to show the truck driver going down the interstate beside her boob. And she said, "I knew at that point I had to go in for an adjustment."
Well, that's a better story.
So the moral of that story is you have to have your hormones managed by an appropriate provider.
So what do you think the future of this field holds? So you think that there's things that we don't even know, we can't even imagine right now? Do you think we're kind of just now catching up with things that have been around for a long time? Where do you see this field going?
I think it's just people are not being educated. Medical school, again, they don't really teach you how to deal with, the menopausal woman. They might just say, put them on antidepressant, put them on Paxil, maybe some gabapentin, they'll be fine. Like, you're just masking the symptoms. And I think the field is evolving. I think because there's a need that is so high and patients are demanding treatment, I think we have to educate ourselves. We have to go back there and research and do our best job in order to help these people that are coming to you to get help. So it is our responsibility to get educated.
People are definitely exploring options to be educated more in this field for sure. I guess working in this space and hearing about it, you definitely know more than I do on some of these topics. But I look at like weight loss. I couldn't have envisioned, a decade ago where we would be today with like the GLP-1 or the mixed, agonists that we have now, that these patients are losing these massive amounts of weight. And now we're finding out that it impacts many other parts of their life, their Alzheimer's risk, right? Their cardiac risk. All of these things were changing through an injectable now that was something that maybe we only achieved with surgery just a few years ago. And so I see in this field, it's like, I think we're just at the point of catching up of like there's only been a handful of providers nationwide that truly understand hormones and functional medicine. And we're just at that beginning of this field where a lot of providers are starting to go out and seek this knowledge on their own, doing what you did, trying to educate yourself so you can help your patients. And I think it's just interesting to think about what the future will hold. And so are we going to be using some medications or agents that we don't even know, we can't even envision the mechanism right now that's going to stimulate our body to make our own hormones, right? So when we talk about peptides and peptide-like analogs that we can use to make our body make our own hormones.
Yeah, I love peptides. We can talk about peptides all day too. There's just so many out there that really helps. We use them, not a lot, but when I have patients that are on weight loss program, the hormones are fully optimized, but they still can lose the weight. I might add some ipamorelin into the picture along with their GLP-1, and God, that works so good. Like,
isn't there a peptide that's like a workout? It stimulates a workout?
No.
Okay, I thought there was one like that. I'm like, that's the one, I need that one too. So.
I do have a really good success story with that. I have a patient, she is 34, I think, at this point, and she was 300 something pounds, and she wanted to start a family, and she couldn't get pregnant. And, she was told by infertility, specialists, like, either you lose the weight or there's no way you're going to get pregnant. But no one was giving her options. Like, they were like, yes, you have to lose the weight, but okay, how am I going to lose the weight? And metformin doesn't really work for that. So she started semaglutide, and she dropped the weight, and 2 months ago she got pregnant. That really made me,
I love that.
Seeing her happy made me happy. And I think we were both crying that day at the office. And I hope I get invited to the baby shower.
But I think that goes to really kind of the heart of why a lot of us do this. I mean, Jerry, why did you go into medicine?
To help people.
To help people.
And it's a one sentence answer.
And he still says to this day that hospice was one of his favorite jobs. And you think that that's depressing and sad. But at the heart of that, it is a healthcare provider that's helping people through difficult times in their life. And so I think all of us derive a lot of joy in helping others, whether it's helping them look better, feel better, get this pregnancy, helping them through the end of life. It's helping people through these difficult times. A lot of us healthcare providers, that's what we find joy in. And, I applaud you for finding a pathway that you can do this and make it work, and that you didn't fall just in the traditional route of these, 10 or 15 minute time blocks where you can't really do that you can help your patients and find joy in it while you're doing it.
I would probably go crazy if I was still on the traditional, insurance mandatory practice.
Well, thank you so much again for taking time to join us today. Guys, we're going to put some links to Dr. Ayala's website. You guys can follow her along on her social media. She's got a great practice. If any of you are in the area and you want to check her out for hormone optimization, you can see she's a wealth of knowledge and experience, and we appreciate her being here. Thanks for joining us for another episode of Beauty and the Brain.
We'll see you soon.